Today, we are tackling a heavyweight topic, one that is pretty much guaranteed to show up on your PTCB exam, coronary artery disease. Seriously, getting this right is crucial for scoring points, but even more importantly, for patient safety down the line. So let's get focused and dive right in.
Hello and welcome back to the PTCB Prep Guide channel. I'm so glad you're here today.
So here's our game plan. We're going to build your understanding of CAD from the ground up, using some really clear diagrams and highlights as we go. First, we'll define what it actually is. Then we'll look at the key symptoms. After that, we'll cover treatment goals, and then, oh yeah, we're doing a deep dive into the must-know medications, before we wrap it all up with the absolute essentials you need to have locked in for your exam. All right, let's start with the why. See, before we can even think about the drugs, we really need to get a solid handle on the fundamental problem we're trying to solve here.
So what on earth is coronary artery disease?
The easiest way to think about it is like a plumbing problem. Your coronary arteries are the pipes that supply the heart muscle with all that good oxygen-rich blood. Well, in CAD, these pipes get all narrowed and hardened, and that means less blood and, crucially, less oxygen can get through. It is by far the most common type of heart disease out there. And what's causing this narrowing? Well, the main culprit has a name: atherosclerosis. This is basically the clog that's forming inside those pipes. Over a long time, these fatty deposits, which we call plaque, just build up and up, making the arteries hard and narrow. This is the #1 cause of CAD.
So you can see the chain reaction, right? Those arteries get clogged by atherosclerosis, and now the heart muscle is literally being starved of the oxygen it desperately needs to function. That state is called ischemia. And you gotta know, an ischemic heart is a distressed heart, and that is what triggers all the warning signs we're about to talk about.
Okay, now that we understand the why, let's look at the what. These are the key symptoms you've got to recognize, not just for your exam, but for real-world patient safety. This is important stuff. The main symptom of CAD is chest pain or angina. But listen, there's a critical difference you have to know. Stable angina is predictable. It's the kind of thing that happens when you're exerting yourself, like climbing a flight of stairs, and it goes away when you rest or take nitroglycerin. Unstable angina, on the other hand, that is a 5-alarm fire. It's severe, it's completely unexpected, and it is a true medical emergency. Knowing that difference is a classic PTCB test point for sure. Now, beyond chest pain, you also need to be on the lookout for shortness of breath. The technical term is dyspnea, or just general weakness and fatigue. And remember this, the pain doesn't always stay put in the chest. A lot of times, it can radiate to other areas like the jaw, the neck, the back, or even down the arms. So, we've identified the problem. We know the symptoms. The big question is, how do we fix it? Well, managing CAD is a multifaceted approach, but for your exam, the focus is going to be razor sharp. Treatment for CAD really rests on 3 main pillars. You've got lifestyle changes, things like diet and exercise. Then there are revascularization procedures, like putting in stents. But the pillar we're zeroing in on for the PTCB is, you guessed it, pharmacological therapy, the medications. This is where your knowledge as a technician is absolutely vital. All right, team, this is it. This is the core of what you need for your exam. Let's jump into the high-yield medications for CAD. Pay super close attention to the drug classes, the common names, and especially those key side effects. First up, we've got statins, like atorvastatin. Their whole job is to lower bad cholesterol. The huge side effect you need to know is myopathy. That's muscle pain. And in rare severe cases, this can actually progress to rhabdomyolysis, a really serious condition where muscles break down. Next, antiplatelets. Think aspirin and clopidogrel. They prevent blood clots from forming, so it makes sense that their biggest risk is bleeding. Finally, we have nitrates, and the star player here is nitroglycerin. These guys widen blood vessels to relieve chest pain, but a very common trade-off is a powerful, pounding headache. Okay, moving on. Beta blockers. You can always spot them with their olol ending. They slow the heart rate and lower blood pressure. So logically, they can cause bradycardia, which is a slow heart, and fatigue. Then we have ACE inhibitors, ending in pril. These are so important for protecting the heart, but they come with 2 classic side effects. One is that persistent, annoying dry cough, and the other, much more seriously, is angioedema. That's a dangerous swelling of the face, lips, and throat. And lastly, calcium channel blockers, like amlodipine, which can also cause a headache or something called peripheral edema. That's just swelling in the ankles. Okay, quick pop quiz. Of those 2 ACE inhibitor side effects we just mentioned, which one is a potential medical emergency? That's right, it's the angioedema.
The dry cough is a nuisance for sure, but that swelling, that can be life-threatening. You absolutely have to remember that one.
Phew, we've covered a lot of ground. Now, let's boil all of that down into the absolute must-know facts for test day. This is your final high-yield review. Let's lock it in.
Let's lock in these must-memorize pairs. Seriously, think of these like flashcards in your head. Statins, muscle pain, and rhabdomyolysis. ACE inhibitors, that classic dry cough. Antiplatelets, bleeding risk. Nitroglycerin, acute angina attack. If you remember nothing else from this section, please burn these 4 associations into your brain.
Counseling on sublingual nitroglycerin is a core technician competency, and you will be tested on it. The steps are so precise and have to be followed exactly. 1 tablet under the tongue the second the pain starts. If that pain is still there after 5 minutes, the next step isn't another pill, it's to call 911. That is the single most important step. While they're waiting for help, they can take a second and then maybe a 3rd tablet 5 minutes apart. But that call to 911, it is absolutely non-negotiable.
And you know, this is exactly why CAD is so heavily tested. Your role isn't just about putting pills in a bottle. It's about being that last line of defense, making sure patients know how to use these powerful medications safely and effectively. Your knowledge here is fundamental to patient safety.
So I'll leave you with this thought. Knowing all these drugs is great for passing the exam, but how can you take this knowledge and use it to empower a real patient who's standing right in front of you, helping them feel confident in managing their own health? Because that's the real goal.
If this explainer helped you finally master coronary artery disease, do me a huge favor and hit that like button. And for sure, subscribe to the PTCB Prep Guide channel for more of these focused, single-topic explainers that are designed to get you exam ready.
And finally, I want to hear from you. What high-yield topic do you want us to break down next? Let me know in the comments below. Thanks so much for watching, and happy studying.